15 to 17 degrees below average. We will have a lot of sunshine, but there will also be a breeze. That breeze will make it feel even cooler, even if you are standing in the sunshine. Again, actual high today, 49 or 50 locally in the Twin Cities, up to Hinckley, Grand Rapids, Duluth, Grand Marais, all in the 40s, all of Wisconsin in the 40s as well. Slightly less cool across parts of far western Minnesota and southwestern Minnesota, but not much warmer, only lower to mid 50s there. Our average high temperature, again, here in the Twin Cities this time of year is 67. It's nearing 70 in southwestern Minnesota, and even northern Minnesota this time of year is typically in the lower to mid 60s. It will be quite a while before we see a day that warm, probably next week, as we have another cold night. In fact, probably tonight even colder than last night ahead. That's why there's another freeze warning in effect for the Twin Cities and a frost advisory in effect for parts of southwestern Minnesota. Central and northern Minnesota will also dip to, or in more cases than not, below freezing, but the growing WCCO.
We're breaking into programming for the Department of Health's daily COVID-19 briefing. Let's listen in.
Please be advised that today's call is being recorded. If you require any further assistance, please press *0. I would now like to hand the conference over to your speaker today, Mr. Peggy Flanagan, so you may begin.
Good afternoon, and thank you for joining today. You will hear from Governor Tim Walz, the Minnesota Department of Health Commissioner Jan Malcolm, and Minnesota's Lieutenant Governor Peggy Flanagan. We also have a number of commissioners in the governor's cabinet on the phone to answer questions. And as a reminder, we ask all reporters to please limit themselves to one question each with a single on-topic follow-up to ensure we can get to as many questions from as many different media outlets as possible. And with that, I'll turn it over to Governor Tim Walz.
Thank you, Teddy. Good afternoon, everyone. Good afternoon, Minnesota. Thank you again for joining. And as you heard Teddy say, Commissioner Malcolm will update us on the health side of things. It's a pleasure today to have Lieutenant Governor on, who's working tirelessly on many fronts, and we'll be able to discuss some of her work on the working groups. It is, as we anticipated yesterday, and as the climb goes, our death rates are up again, and it at a steady pace, but still higher, and we've gone over 10,000 cases. And again, these grim milestones are just a reminder that we're still in the thick of this fight. The hard work that was done to buy time has put us in a much better position to fight it, but the fight is still here. So if you remember a few weeks ago, our administration, we put out and talked about a series of working groups to address COVID-19, both internal to state government and external building partners who came in from business and nonprofits to help us. These working groups were tackling the challenges and lanes of responsibility on many fronts. One of them was securing personal protective equipment, critical care, the testing expansion that's still going on, the protecting of vulnerable populations, homeless and seniors. You heard Commissioner Malcolm speak a little bit about the battle plan on the senior front, identifying the alternate care sites so we can ensure all Minnesotans get the care they receive. Joe Kelly and his team went out there, did a proving that we can get that up and running, and just validates that we're ready to go. And then, of course, the economic side that we've been talking about. How do we smartly restart the economy without turning that dial too quickly and end up back where we were at? Amongst all those things, there was a need, and we're seeing it highlighted more and more, the need to make sure that equity ran through how we do things, and specifically racial equity. We're seeing this across the country, that COVID-19 is exacerbating some of those inequities. And I asked Lieutenant Governor along, and she partnered with Department of Human Rights Commissioner Rebecca Lucero to lead a community resilience and recovery work group to think about how we move forward. The Lieutenant Governor said very early on, when someone said COVID-19 was the great equalizer, she pointed out that was not the case. It ended up showing some of those inequities. So a public health crisis now exacerbating those differences. So I'm excited today to hear a little more, as you'll hear from the work the Lieutenant Governor's doing, and building strength in communities and working with the legislature to find some real fixes. And that brings me to our next piece. I'm going to make a public ask of our partners in the legislature today. They did together on March 19th. We all worked together to create the Minnesota COVID-19 Fund. And that action made a big difference and I believe saved lives. It created the $200 million fund to provide resources to protect Minnesotans from COVID-19 and maintain our operations during the crisis. Currently, there's about $65 million remaining in that fund, but there was a sunset on it and it expires May 11th. What that means is that COVID-19 fund was used to buy the testing material, which is key to opening back up and controlling this pandemic. It was used to prepare the alternate care sites to make sure that if we do run into what states like New York did, we would have the capacity to have the overflow ready. And it was used, what we use daily, to procure the protective equipment, 10 million masks, hospital equipment, ventilators, and those types of things. So what it does allows us to move quickly. The legislature has oversight of that. They put the money in, and what we're asking for is for them to take a look at this as being a great tool that we've been able to work together on. It made our response move faster, and what we really need them to do is to certainly, we've been seeing if they would just move the expiration date from the 11th, but I think it was a great tool that they came up with. It's one that we've agreed on, worked together, and been successful. And I would just hope they could find a compromise by Monday to continue that on. And finally, I'd say we spent this week trying to highlight different professions involved on the front lines. And I know there are so many, it's hard to list them all, but we started with childcare providers, teachers, and nurses. And today, this is one that many times, these are folks that do their job pretty much out of sight. And if they do, the rest of folks might not know how challenging this is. And that's our Minnesota correctional employees. They provide the critical service to our community. They're highly trained. They're there to keep the incarcerated and until their time to come back out. But they're also a responsibility to help the folks that are there develop better decision-making skills. They deliver mental health care, they offer world-class educations, and they prepare individuals to come back and be productive members of society. 95+% who will do exactly that. They will be our neighbors. They do all that during a pandemic, keeping people safe, and sometimes very challenging, as we all know, all too often can be dangerous situations, especially when an older facility, when you have folks confined, that is a very bad recipe for things to go badly. And these folks are doing that every day while trying to keep themselves free of the pandemic and then making sure that those they're responsible for in our incarcerated neighbors safe too. So I just want to give a great heartfelt thank you to those Minnesota correctional employees, Commissioner Schnell, Josh Sergimaki over there doing some great work, working with the Navy infectious disease teams to figure out how do we make sure that that those we're responsible for are treated fairly humanely and that we keep the public safe at the same time. So thank you to all of them. At this time, I'll turn it over to Commissioner Malcolm for an update.
Thank you, Governor. Good afternoon, everyone. I'll quickly go through the data for the day, and then we have a couple of issues we'd like to dig more deeply into. In terms of the global and the national situation, globally, as of early this morning, we were at 3.86 million cases and 269,000 deaths. In the United States, 1.25 million cases and 75,600 deaths. So the pace of these increases continues to be really pretty staggering. Here in Minnesota, as the governor has indicated, we had another day of significant growth, as we are expecting. We're going to see about this volume or increasing in coming days. 720 additional laboratory confirmed cases yesterday, bringing us to a new total of 10,088 cases in Minnesota. That is of interest. This is on a testing volume of just under 3,900 tests. We are learning, though, that we've got some issues with some of the laboratories reporting later in the day after our daily data cutoff. So we're still having a little bit of bouncing around day to day in terms of which tests go with which days. We're also discovering that some laboratories are only reporting their positives to us and not their total case volume. So more data cleanup on the lab front to come, but we are making steady progress on getting lab testing to where it needs to be. Also, in terms of the new case counts, we've been talking a lot about the 5 counties with food processing plant outbreaks. Interestingly, the 2 largest counties where these outbreaks are happening, Stearns and Noble, account for a lower percentage of the new cases that we're announcing today, just under 20% of the cases, as opposed to a third of the cases reported yesterday. So that's an important thing to note. In terms of the mortality rates, unfortunately, an additional 26 Minnesotans died from the COVID-19 disease yesterday, bringing us to a new total of 534 deaths in Minnesota. 25 of these 26 deaths occurred in residents of long-term care facilities. 20 of these deaths were in Hennepin County, 3 in Ramsey, 1 each in Benton, Olmsted, and St. Louis. Demographics continue to be similar. 10 people in their 90s, 9 in their 80s, 5 in their 70s, and 2 in their 60s. There are 473 patients currently in the hospital. 198 of them are in intensive care. I have some interesting news to share. You may be aware that the drug maker Gilead has a drug, antiviral called remdesivir, that has been shown in some early trials to offer potentially beneficial treatment effects for people with very severe cases of COVID-19 infection. According to Dr. Anthony Fauci at the National Institutes of Health, one of the largest initial studies showed that people receiving the drug were able to be discharged from the hospital 30% shorter timeline. So discharging after 11 days on average compared to 15 days in the placebo group. So that would be extremely good news if that kind of effect holds up in terms of both helping to treat people and helping to manage hospital capacity just that much better. And certainly gives us a bridge for additional time for additional treatments that we know are going to continue to be developed in the coming months. The manufacturer Gilead made a significant donation of this drug to the Health and Human Services Agency at the federal level, and they in turn are distributing it out to the states. We just learned that we are expecting to receive limited initial shipments of remdesivir, which we will be able to then allocate to some of our healthcare facilities for treatment of people hospitalized with severe COVID-19 cases. This is just I'm told by the CDC with whom we spoke that this is a first shipment, that we hope there will be more, but with the processes that we have in place in consultation with infectious disease physicians and ethicists, we are developing criteria for how we will distribute that remdesivir around our healthcare systems with an eye to maximize the number of lives that we can impact, taking into account risk and expectation of benefit, and also equity and fairness and transparency in how those shipments will be shared around the state. We're happy to provide more updates on this in the days ahead. I would like to talk just for a few minutes about, again, about COVID-19 and health equity before turning it over to our Lieutenant Governor. We in the health community, public health, healthcare, community-based organizations, nonprofits have been working for years to call attention, decades in fact, call attention to the state's alarming health inequities and to try to address them. And COVID-19 has only added urgency to this challenge. COVID-19 shows us again that the health problems of one person and one community impact all of us. We do know that people of color and Native Americans are experiencing multiple inequities in income, housing, employment, etc., that make them disproportionately susceptible to multiple health issues and chronic conditions, such as diabetes, heart disease, severe asthma, etc. And this puts them at significantly higher risk for severe illness from COVID-19, as we've talked about. We also know that Native Americans and people of color, particularly immigrants and refugees, also are often the ones working in industries identified as essential services as businesses, such as manufacturing, the food industry, and long-term care and healthcare, as we talked about yesterday at some length. And these environments where COVID-19 may be spread more easily if there are not appropriate preventive measures in place are putting these workers at increased risk. And we're seeing these inequities emerging in our COVID-19 data, and we've been reporting on this for a couple of weeks now. We know that Black and Hispanic Minnesotans are disproportionately represented in the total number of cases and hospitalizations compared to their population in the state. For instance, Black Minnesotans account for 6.6 of the overall Minnesota population, but nearly 17% of all COVID-19 cases and over 19% of hospitalizations. Hispanic Minnesotans account for 5.5% of the state population, but nearly 14% of COVID-19 cases and 9% of hospitalizations. We've talked about the fact that healthcare workers are disproportionately represented by people of color and Native Americans, and there too, they are being hospitalized at a higher rate even than their proportion of those healthcare workforces. And yesterday we talked specifically about the long-term care workforce and the significant concentration of the African immigrant population among that workforce and their much higher case prevalence and positive rates. So I think it just underscores what we've been saying that we knew was going to show up in these data, and the data are indeed confirming that the burden of this disease, like so many other things, is not spread evenly across our population. So it's just so very critical that we continue to work to assure that our approaches to prevention, information dissemination, data collection, and testing are informed by a health equity lens so that we reach all Minnesotans, and particularly those who are at greater risk. And with that, it's my honor to turn this over to our Lieutenant Governor.
Thank you so much, Commissioner Malcolm. Good afternoon, everyone. We know what Minnesotans are doing a good job of. We know that they're doing a good job of social distancing, and we're thankful for the time that you've brought us to be able to build up surge capacity, ramp up testing, and put together a comprehensive response. But we know that we also cannot let up and let this crisis quickly take a turn for the worst. And so this is especially true in communities of color and Indigenous communities. We know that the COVID-19 pandemic falls hardest on communities who are already in crisis. That includes the unequal impact of COVID-19 and that it has on our Black, Asian, Latinx, Indigenous, immigrant, and refugee community members throughout the state. This public health crisis is exposing and exacerbating the racial, economic, and educational inequities that have been here all along. As an administration, the governor and I are focused on what we can do across the state in partnership with community to ensure that our most vulnerable Minnesotans are centered in our statewide response across public, private, and nonprofit sectors. In order to do that work effectively and intentionally, the governor and I launched the Community Resiliency and Recovery Work Group on April 17th. This work group is laser focused on making sure that racial equity is at the forefront of those critical issues. And as the governor mentioned, I'm co-leading this important work with Commissioner Rebecca Lucero of the Minnesota Department of Human Rights, along with leaders from across state government and about 100 external advisors. The scope of this work is to develop and implement near and long-term strategies and guidance within the state to best support recovery and resiliency with an intentional focus on communities of color, Indigenous people, and immigrants and refugees. Our administration has always been committed to listening and learning from community. And that commitment has not wavered during this pandemic. Over the last several weeks, we have listened to and talked with communities of color. And to those who have shared their stories, I want to let you know that we are listening and will not stop listening and working hard for you. The Community Resiliency and Recovery Work Group has also been focused on increasing transparency and reporting data regarding the racial impact of COVID-19. And I appreciate that Commissioner Malcolm broke down today's health data by race. It helps us to further understand how COVID-19 is impacting our Black, Latinx, Indigenous, and Asian community members. And today I'd like to just share a few more pieces of that data with you so that you have a sense of what we've been analyzing and collecting. As Commissioner Malcolm shared, Black and Latinx Minnesotans are testing positive and hospitalized at disproportionately higher rates. We also know that Black and Latinx Minnesotans have increased exposure to the virus because of the higher rates of work in low-paying jobs that are now considered essential, such as childcare providers and grocers. And this also means that their family, our families, and loved ones have higher rates of exposure to COVID-19. There's also a disproportionate economic impact on families. More than 1 in 4 people of color in Minnesota's labor force have applied for unemployment insurance. And I want to break that down further for you. So this is 29.8% of American Indians in Minnesota labor force, 20.8% of the Hispanic labor force, 22.4% of Minnesota's labor force who are Asian, and 31% of Black Minnesotans who are part of the labor force have applied for unemployment insurance. And it's critically important that we are really transparent about this data so that we can really see the issue and target it appropriately. Black and Native Minnesotans already experience homelessness at disproportionate rates. About 1/4 of Native people and more than 1/3 of Black people are experiencing homelessness in Minnesota have tested positive. So the data is really clear. We cannot allow these communities to remain invisible as we consider our response to the recovery efforts. We will continue to update you with data and the critical work that our administration is doing to center racial equity and community resiliency in the state's recovery efforts over the coming weeks and in the months ahead. And we are all connected to one another. And in Minnesota, we come together across lines of difference because that's how we improve the lives of Minnesotans. So thank you so much. And now I'll turn it back over to the governor.
Thank you, Lieutenant Governor Flanagan, and to all the partners involved in this important work. We need to make sure no one is left behind, both during the time of pandemic, during the recovery time. So with that, Teddy, I think we will open it up to questions from the press.
Ladies and gentlemen, as a reminder, to ask questions, you will need to press *1 on your telephone. To withdraw a question, press the # key. Again, if you would like to ask questions, please press *1. Please stand by while we compile the Q&A roster. Your first question comes from the line of Thea Kit from Fox 9. Your line is open.
Governor and Commissioner Malcolm, you talked earlier about your request that the legislature re-up the COVID-19 fund. The most recent large approval for purchase is going to turn some heads when people see about this. $6.9 million for, quote, temporary storage of human remains. What does that mean? What is being specifically purchased there? What is it for? And where is this temporary storage?
Yeah, thank you, Theo. I think, for all the press on this call, I have our whole contingent of commissioners on today. So this one, I think between Joe Kelly, maybe Alice, and then of course, Commissioner Malcolm has been working. So if one of the experts wants to pick this up.
Yes, we'll take Commissioner Roberts Davis and I will take the lead here, Governor, and good afternoon, everyone. I know this is a sensitive topic. It's an uncomfortable topic for a lot of people, but we need to have a capability. We need to have a plan for a large number of deaths. The facility, what's contemplated by the purchase is to buy a building where we can properly handle with dignity and respect and safety the bodies of Minnesotans who may fall victim to the coronavirus. So that's the purchase. Excuse me, the purpose of the purchase. And if you consider some of the images that we've seen around the world and around the country in places like Italy and New York, where they were not able to handle a surge of fatalities, and had to bury people in shallow graves, a temporary interment. We just do not think that is acceptable. We've gotten a lot of input, guidance, and encouragement, and even requests from a broad range of folks that are concerned about our capability and make sure we have the capability to handle a large number of fatalities, including funeral home directors, medical examiners, hospitals, public health, local emergency management. The concern and the rationale behind the action that we absolutely believe that we have to take in the present, excuse me, the movement through the system that we normally use to take care of our deceased and properly lay them to rest, the movement through that system has slowed dramatically. One, because of just some increased volume, if you will, and secondly, because with social distance guidance in place, it is often difficult to meet the final wishes of our loved ones, to have their family gathered around as they're laid to rest and observe their traditions. So what's happened is, because there's been a slowdown in the number of funerals and burials that are taking place, is that, for lack of a more delicate term, the storage in funeral homes and hospitals is in some cases full and overflowing. So we want to provide a facility where, again, we can properly, safely, and with the appropriate dignity and respect that we think we owe our fellow Minnesotans and their families, to temporarily store them until their families are ready to lay them to final rest. As we look to the future, we're also concerned, and we know, and we have seen places, again, around the world and around the country, where a surge of fatalities has been more than the local community has been able to handle. And we look at it not just for now, not just May or June, but we look at that capability throughout the pandemic. So that's, from my position, that's sort of what we see as the need and the request from our local communities, as well as our eye toward the future. Because, again, I would just say that we believe very strongly that we owe our loved ones, our neighbors, our friends, as well as their families, to be able to handle that appropriately. So that's what that $6.9 million is for.
A couple of specific follow-ups, because it's a very specific number, 6.9 million. Is there a contract in place? Is there a building identified? And if so, where is it? And what type of building?
Well, there is a building identified. That's how we come up with the specific number. It is a warehouse facility, to describe it generically, and we are in negotiations with the property owner and their agents, and we look forward to briefing that in the future.
Can you give us a city?
Because of the ongoing negotiations, I will demur on that request respectfully.
Okay, thank
you. Theo, we'll try and get it to you as soon as possible. Joe, I appreciate that compassionate answer. This was a tough one, and Theo, I would say this is one that the legislature, which is of course providing oversight, brought up, and we answered some questions, because I think some of the logical questions you ask is why don't you just lease something? And obviously, once you use something for human remains and the way they're talking about converting this building, that makes that very difficult. But we will get you that information as soon as it's appropriate to get there. And Director Kelly, I appreciate the way you handled that with dignity. This is a really tough one for all of us to talk about.
Thank you. And your next question comes from Bill Werner from Minnesota New Network. Your line is open.
Hi, Governor. Yeah, thank you for taking the question. This is in regards to the Education Department's guidance on graduation ceremonies. And some Republican lawmakers are not happy about that. Representative Erickson as an example, says, it's incredibly disappointing the administration took this unilateral action with no warning and no flexibility for schools that are able to hold their ceremonies safely. She says this one-size-hurts-all approach completely ignores thoughtful deliberations and plans already in place with local school leaders. Some school districts are saying they're small enough, their graduating classes are small enough that they can practice social distancing and watch the entrance and egress of the various participants such that it can be safe. Would you respond to their concerns, Governor?
Yes, and I think, as I've said, and I would tell the legislator, I'm pretty certain that there's very few people that attended more graduations than myself and the First Lady. And this pains me like all of these decisions do. We're certainly not trying to do one size fits all, and I get it that there's a lot of folks don't believe we need to have social distancing. We don't need to wear masks. But I need to listen to the health experts on this. And what my response to be to them was, and I think maybe I'll have Commissioner Malcolm come in, I have pushed incredibly hard on this to find solutions. I have asked, what about 20 kids at a time in 10 different ceremonies? What if how do we best do this? And every time we leave ambiguity in one of these, then we get why aren't you being more specific? Why don't you do this? Why can't we go over here? And these decisions come back to, I have to rely on the experts to give both the health opinion and then the well-being and the capacity for us to be able to do it. So, you know, a one-size-fits-all thing. I would just say in this, and I'm pretty sensitive to criticisms around this because it's my life and where I'm at. And we are trying our best to make sure that we are striking that proper balance between public health and these important social milestones. So I'm pretty certain I'm hearing this, you know, and thinking about this as much as anybody. I'll let Jan talk a little bit about it. And what I've said is that districts have asked us for immediate guidance. That guidance can change as the situation changes, as testing changes. We have moved dramatically from March 25th. Many different things have changed in that amount of time. Many things have changed from April 15th. So one of the things that I have been asking about is what does June look like? That's what people are asking me. It's very difficult to imagine numbers going down. It's very difficult to imagine that our death counts aren't going up. And it's very difficult for us to figure out exactly what that looks like. But as I've said, we're trying to give as much clarity as we can with as much lead time. And because of the need for that, MDE and MDH put out guidance as of today. So Jan, maybe I'll turn that to you, how we came to that.
Yes, thank you, Governor. And I think you did a great job of explaining the context here. And it is with all appreciation for how difficult this is and how disappointing. But we just do have to remember the context that we're talking about here. We're heading up the steepest part of our curve. It's only going to get steeper. The numbers are going to grow. Our health guidance is still that people should not be gathering in groups outside of their immediate household if they can possibly avoid it. And people are going out for essential services and continuing to work in hopefully as much virtually as possible and with a lot of social distancing and a lot of protection. But the focus really has to be on minimizing contact outside of our immediate households right now. And even though folks have made the argument that they can do social distancing on the field or in the stadium or whatever, you already mentioned there are challenges around coming in and going out and what happens out in the parking lot and just the reality of an emotional time when people are going to want to celebrate, and we understand that, and we know how painful it is not to be able to do that. But we talk in terms of the predictability of a situation and how certain one can be that social distancing can be retained. And in this case, painful as it is, this does not seem like a situation that would lend itself to to good adherence to social distancing. And so we really are encouraging that schools and communities find creative ways to do it. We've seen some coverage of graduation car parades and things of that nature, and certainly virtual graduations. We know that's not the same thing, but people are finding creative ways to still celebrate this accomplishment and try to make meaning in a different way.
Just very briefly, Commissioner and Governor, along that same line, and you discussed this yesterday, Governor, but there's no guidance in the recommendations from the Minnesota Department of Education, and this is small gatherings. I'm talking about graduation parties, not exclusively of family members, but maybe a few others. You mentioned I think you said yesterday you're trying to turn over every stone, how to figure out how to do that. Those were your words. Can we expect anything on that for folks who maybe want to hold a small party with a couple of cousins or grandparents, or maybe grandparent would be a good idea, but at least close friends?
Yeah, Jan, do you want to speak to that? Because I think, Bill, of seeing the human side of all of these decisions, and there is never a one size fits all with these because of the complexity. Sometimes it's just providing the clear guidance, and we're still discouraging, and the stay-at-home order discourages people from gathering in groups. Again, not because we don't want to see graduation parties or families gathered together, because we don't want to see folks transmit COVID. So, Jen, could you talk about that as we talk about that dial on social distancing, which is small family gatherings, is kind of the next notch?
Right. Thanks, Governor. And yes, that we are continuing to look at that. We're continuing to look at emerging CDC guidance on size of gatherings and gatherings specific to different kinds of settings. As the governor considers what comes after May 18th, that's certainly something we'll be looking at is whether and how to update our guidance on social gatherings. But as of now, it does continue to be our strongest recommendation is to try to keep contact within the immediate household as much as possible. But we will be discussing the size of gatherings further in the next coming days.
Thank you very much.
Thank you. Your next question comes from Matt Sepik from Minnesota Public Radio. Your line is open.
Hi there, Commissioner Malcolm. I know you mentioned that you were talking about running the model again by the end of this week. Has that happened? And if so, what are you seeing in it?
And I apologize that we didn't meet the timeline that we had set out for the new model. My understanding is that they're running some confidence intervals and so forth yet today. So no, we do not have the model at this point in time. I know that I just understand basically what's different about it, that they've put some new variables in, they've adjusted some things based upon what we now know about hospitalization rates and the like. But I'm sorry, we don't have it to share for you today. We're expecting another commitment that they tell me we are going to be able to keep mid next week is to put the source code online as well. So we'll be updating, all of the technical information, the calculations, the variables, all of the things that is on our website now about the earlier version of the model will be all updated, including the source code itself by no later than the middle part of the week. I'm assured that it's close, but I do apologize that we missed our timeline on that one.
So you said the source code will be up online by the middle of next week. Does that mean the model will be run again with these new variables as well, or are you still waiting on that?
Oh, yeah, sorry, I wasn't clear. Thanks for allowing me to clarify that. Yes, I'm expecting that we will have a new model to review with the governor by early in the week.
Okay, thank you, Commissioner.
Thank you. Your next question comes from Dave Orick from Pioneer Press. Your line is open.
Hi, thank you. Lieutenant Governor Flanagan,
And I'm sorry, I'm looking for this in my notes as you said it earlier. You gave some figures regarding Black and Native American people who are homeless and who tested positive. And I think it's like a quarter of homeless Indians tested positive, a third of homeless Blacks tested positive. Do I have that right? And can you put that in a context of how that fits in with the larger homeless population and the other population groups in general? We don't generally hear positive rates broken down by demographics. So I'd like some context for that.
Yeah, sure. Thank you for the question, Dave. So that's correct. So I said Black and Native Minnesotans, already experience disproportionate rates of homelessness, and about 1/4 of Native people and more than a third of Black people experiencing homelessness in Minnesota have tested positive. And again, we expect those numbers, right, to likely go up as we increase testing capacity. People experiencing homelessness and the unsheltered population in particular was a crisis beforehand, before this pandemic hit. And so we know, of course, that this is now exacerbated by the pandemic. Pre-COVID, if you were Native American in the state of Minnesota, you were 27 times more likely to be unsheltered than the white population. And so these are really difficult issues. And I want to make sure, though, that I am getting you, Dave, we will follow up to get you some of those additional specific numbers so that you can have access to those. We think this data is really important and want to give that additional context.
Okay, thank you. And is there a belief that do we have sort of hotspots of shelters and places like that, or is it being spread in the sort of encampment type areas? What do we know about the spread in this population?
So we do have our at-risk population work group that is looking closely at shelters and at encampments. I know that MDH is tracking this. And so I'm wondering, Commissioner Malcolm, if you could add anything additional here.
Yes, thanks, Lieutenant Governor. That is one of the highest priority populations that we want to really do outreach and testing specifically in those communities. So the data that we have today are largely from folks who have been tested in the context of seeing a healthcare provider or some crisis situation where it's been evident that they need to be tested. But we really need to do more than that. We need to test more broadly in shelters and in the situations such as you mentioned in the encampment. So I'm aware that there's a lot of good work going on between the city of Minneapolis and Hennepin County Public Health Departments and Hennepin Healthcare, for example, to be ramping up the testing in those communities. So it's the data that we have right now, as the Lieutenant Governor indicated, we know is just the tip of the iceberg.
And I think it's important also to note, I think it's also just important to note that we haven't tested at scale, and we also need to create more isolation spaces. I want to just clarify that data that for the Black and Native populations, the numbers that I gave you, that's the rate for people who have tested positive and are experiencing homelessness.
Yes, thank you both.
Yeah.
If I could, I would just, first of all, thank you, Lieutenant Governor. Dave said something really important there for the listeners that are out there. And I think this spurred this conversation. One of the reasons the work group and Lieutenant Governor are on today is Dave picked up on this. He said we don't usually see those numbers disaggregated like that. And he's right. And it's one of the things that Lieutenant Governor and Commissioner Malcolm have been pushing and working on to make sure, because if we're really going to get a handle on this and we're going to control this the spread of COVID-19 into the future till we get a vaccine or therapeutics, we have to understand how it operates and understand where it's operating at different levels. And to not have that understanding, I don't think it's probably a surprise to listeners that if folks are congregated in shelters, or if they don't have homes and they're of course going to have underlying comorbidities, those would be the natural places, but it's not tracking folks or being able to find them. So I think this is a really important question, and actually spurred us to, I think, dig deeper in this. So thank you, Dave.
Thank you. Your next question comes from Dana Ferguson from Forum News Service. Your line is open.
Hi. Public health officials in Hubbard County say COVID-19 is circulating there, but testing isn't being done. Can you speak to what's getting in the way of that, and other counties that haven't recorded positive cases? Do you anticipate something similar is happening there?
Yeah, thanks, Dana. I'm gonna let Jan have this, and the answer to your last question is yes. This is becoming glaringly apparent both in Minnesota and of course nationally, that the lack of testing blinded us. We had no sight picture on what was happening, and now this is something every morning we started bright and early have a deep discussion on this, and I'll let Jan talk a little bit about this. And if anybody else from the testing team is on, to maybe give a sight picture, why is it that we know we have the capacity today to do over 10,000, but we're seeing 4? I think it's a fair question. It's one of these things we want to test symptomatic Minnesotans, but the sentinel testing of things like that, of like Hubbard County asking, is valid. So Jan, if you could take that.
Absolutely. Thanks, Governor. It is a great question. And with the capacity that we now have, and we've been asking that question, why isn't more of it being used? There are sites all around the state that are listed on our website where testing is available, and the providers are telling us people aren't coming in, either because they had gotten the message previously that testing wasn't available, or for whatever reason. So people aren't availing themselves of the testing capacity that's there, and that we need to do better. We need to do more outreach, have a stronger campaign to make sure that people know that they can and should be getting tested if they have symptoms. But then, to the governor's point, we want to also do surveillance testing. We have a proposal put together, I think, for the legislature right now on some additional funding for surveillance testing that would allow us to go into parts of the state where we just don't have much data, and just try to find some good sampling to give us an overall better estimate. But in terms of, I'm sorry, I'm unfamiliar with the specifics of Hubbard. I'll certainly follow up and talk to the local public health folks there and see what that issue might be, and see what we can do to address it. But we do have testing available. I think the data show that 95% or so of the population is within an hour of an existing testing site. So we definitely need to get that message out that more testing is available, and we encourage all symptomatic people to please go and get those tests.
Thank you so much. And your next question comes from Brian Buck from NM Public Radio. Your line is open.
Hi, Governor. You've already indicated that you're likely to push out your order for the peacetime emergency, but of course, 2 other deadlines are coming up upon you next week, the restaurant and bar restrictions and stay-at-home order. Are you inclined to extend those as well? And if so, how concerned are you that they're going to be ignored as people feel increasing financial and emotional strains of the crisis?
Yeah, I think it's the question that we answer every day, and I think we reevaluate based on all the variables that we have to make an impact on it. As I've said from the beginning, that these are horrible choices. There's no good choices. Public health and public health officials making very informed judgment, and then balancing about what is manageable and what would be the long-term impact. I think one of the things that gets missed in this again folks are not going to go back, and it is overwhelmingly in polling across the country, and we see it here. They're not going to go back if they don't feel safe. So I say this again, it's not ignoring a stay-at-home order from me. It's ignoring public health and science that puts people at risk. And with Minnesota still growing, to gather in a crowded place is, at this point in time, certainly a catalyst for spread. And so I'm not certainly worried about the vast majority of Minnesotans are complying. What I want to try and figure out is, how do we do these things to create this new normal? Because I don't think what's sunk in yet, this thing is going to be with us at least until we get really good therapeutics, or we get herd immunity, or we get a vaccine. But that doesn't mean we can't do some of these things. I know that the stress to get going right now, but basically in Minnesota, this would be the equivalent of New York opening up right before they started up their curve. It's just really hard. Now, the thing is, as you've heard in so many places, we have learned from other people. We will not allow our dead to be set somewhere undignified, which is a horrible, worst case scenario type of things. But on every one of these things, we're thinking about it. And I think we're gathering data on bars and restaurants. So I do think it's too early. I don't worry about Minnesotans, just blatantly not doing it, because I think Minnesotans have proven already they understand that this is just what you do. And when I see people, I'm somewhat baffled by the idea of, I don't want to wear a mask. I'm not going to go into places. We have these discussions about your own personal behavior. If you're by yourself, you make the decision you need to make. But just like smoking in restaurants, we passed a clean air law here, and people no longer smoke. And I think society can't imagine a time when people smoke next to others where secondhand smoke was a problem. So I think Minnesotans have proven they care about their neighbor. They understand that these restrictions are that way. I don't in any way want to minimize the economic pain that is befalling folks, but just opening back up again is no guarantee customers will be there. And we have to figure out a way that we want to help you open back up safely so that there are customers there and people can feel it. And I think that's what we're moving to. We said all along it would be really dependent on testing and tracing. And that's why when we get these questions, is there not enough testing going on in some places? We have to fix that, and we have to keep pushing at it.
Well, Governor, to follow on that, if people are doing such a good job of following these just out of community responsibility, does there need to be an order beyond May 18th?
Well, this is a good question too. It's one of the things of how societies respond. I hear people talk about, Sweden. Sweden did it basically out of, said, just do it on your own. Now, there's several things that happen there. If you poll in Sweden, they have a very high respect for government and government's responsibility. They also have a very high respect for the personal choices that are made, that you're part of something bigger. I do think Minnesotans, if there's a scale, fall more on that scale. And I think it's one of the reasons why, if you look across the country, we have moved fairly wisely, I would argue, while simultaneously opening up while doing the things necessary to stop the spread. So it does require, there's absolutely no doubt, it does require social compliance based on the rules. But again, when I see people say, I'm going to stand in a big group and I'm going to protest this happen. I mean, I don't know if it's a fair analogy or not. I couldn't imagine Britons during the Blitz saying, well, I can turn on my lights because I have the right to turn on my lights. The entire city shut down because it put them as a target. And this idea of gathering together because you can, yes, you can do that, but it also puts everybody else at risk. So I think it's striking that balance of Minnesotans. I do believe this. And here's what I do believe too. I believe these business owners care deeply about making sure that no one ever gets put at risk. And I think they can put things in place to minimize that risk. And that's what we're talking about with curbside and then moving into retail. But I think there's going to have to be an education piece of this. I don't think it'll be the businesses putting people at risk. I think it'll be customers not adhering to some of the rules that we have to be careful about. That's why 49 states went, to stay at home for kids. 47 states had stay-at-home orders or so put into place to try and set the norms that would allow us to be able to figure out with new science 6 weeks later, what can we do that allows us to do that? So I'm working with these folks. I hear them on this. I think the idea that this is a choice between health and economic destruction is one that we cannot make. It has to be a line between them. I think, again, I've said all along, I think Minnesota has maybe one of the best chances to do that with really good social compliance and really aggressive testing, tracing, and isolation. That's your best way to get back into business for good, because to do this haphazard, and I think of business owners, if you open up and it becomes clear that people got sick being there, that is going to be every bit as damaging as a stay-at-home order. So we can't get it wrong.
Thank you, sir. And your next question comes from the line of Tom Hauser from KSTP TV. Your line is open.
Hi, Governor and Director Kelly. This is aimed at the two of you. In addition to that building for the human remains, I know you're also working on the alternate care site in Roseville. I'm wondering what the budget is for that and whether you're aware that about $660 million has been spent on facilities like that for COVID-19 overflow, and most of those facilities have not treated one patient. Can you address if you're aware of that and what the budget is for our overflow facility?
Yeah, Joe, I'll let you weigh in here in a minute. Yeah, Tom, we are very, very aware of it. It's why we took a different approach to this. We surveyed potential sites. We made sure in every part of the state that people were close to it. And then we validated one site. Unlike where they built the Javits Center, unlike where they did some other things, which did end up treating patients in New York City. But I'll have Joe talk to the budget about this. What we thought is this is just smart planning. We have about the capacity to bring about a dozen of these on to reach our full capacity should we hit that peak. If we don't, we have validated this one site to be able to care. So Joe, if that is an accurate description, if you can give some more details to Tom on numbers.
Yes, Governor, and thanks, Tom. Governor, that's a very accurate description of our approach to this, and we have watched and learned a lot of lessons, just like on the previous topic, of what other states have done well and what they haven't done well. The budget for this, I think, is around $1.5 million, Tom, but I will confirm that. This was a nursing home that was in the facility that was in the process of demobilizing, if you will. So the team has gone in there and has actually begun the construction process, and I think they should be finished up next week, if I'm not mistaken, and just kind of put things back in working order to make sure that it's a safe and sanitary and effective healthcare facility. But we're looking, again, I think it's about $1.5 million. I'll confirm that exact amount with you. And as the governor said, we think that is a wise investment in having a backstop.
And a quick follow-up for Commissioner Malcolm on the numbers that you say some labs are reporting only positives and not total cases. How long has that been going on, and how much do we need to look a little differently at the numbers that have been getting reported in terms of percentages of positives to total tests? If this has been going on for some time, it seems to me there might be some doubts about some of these numbers.
Yes, thank you, Tom. I appreciate being able to clarify that. I didn't mean to suggest that was a systemic issue that's been going on all along. I think a couple of other times previously, we've noted on a day or two that one or another of the labs did not report thoroughly. I should have been more clear that we know of one lab for whom that was true yesterday. So I should be more careful not to suggest that's a systemic issue, but it continues to be just a good reminder to us that we need to verify each day, especially as more labs are coming on and increasing capacity, that we're getting the full picture. And some labs just haven't really understood why it was that we needed to see the negatives as well as the positives. So we're
overall, you're confident in the numbers.
Yeah. I didn't mean to overstate that there was a big data problem there. Just today's data we know has a known gap in it.
Okay, thank you all.
Thanks,
Operator,
Joe, if I could follow up with Kenny, could I just follow up with Joe? And Joe, am I right that the alternate care site is FEMA reimbursable? Also,
That is correct, Governor. That is reimbursable. Temporary treatment facilities, medical facilities are. So yes, we will get some help with that.
and I might note to Minnesotans as we're looking at the federal response to this and the 2.3, I believe, billion, the COVID-19 fund, that will be able to be backfilled by the federal government. So the COVID-19 fund that the legislature put in place that we've been using for much of this, that will be reimbursed by the federal government. And as many of you have heard me say on this, there are very few states that receive fewer federal dollars than Minnesota. Minnesota is a donor state, if you will. And because of that, there'll be a lot of this federal money that can help us backfill on this. And this alternative care site is that one. So Teddy, I'm sorry, go right ahead.
That's okay, Governor. I was going to say we're at the top of the hour, so operator, we're going to have to call it on questions for the day. And Governor, I'll hand it back to you for your final thoughts before we drop off here.
Well, thank you all. And once again, I would highlight, thank you to the press. These are great questions. And I think for those of you listening, the folks who spend a lot of time looking at this are asking some of those details. And I think with COVID-19, the real fix is in the details. I'm going to end with a good story here before we go. And this one I really like. Today's World Red Cross Day. And as we've been saying, if you can help and you can donate blood. But this story comes from right here at the Red Cross in St. Paul. Great story. 17-year-old Ethan Hugh. He's a Boy Scout, St. Thomas Academy Junior. This spring, he tested positive for COVID-19. He fully recovered, was out of self-quarantine, and Ethan decided he was going to go see if he was donor eligible at the Red Cross website to donate his plasma to critically ill COVID-19 patients. He heard back and he was. Ethan was very honest. He said he's not fond of needles and was a little nervous, but I quote you this, and I love this one. He said, "I'm in this situation for a reason, and it must be to help others." So, Ethan, thank you for being about as Minnesotan as you can be, overcoming that nervousness and stepping up. This is the way we'll get through this, with just that type of selflessness, that type of neighbor to neighbor. So I really appreciate that. A couple things before we go. I wish everybody luck tomorrow in the fishing opener. I know it's not the usual one, but you can still get out close to home. You can wet a line and hopefully, if you don't have any luck, you can get some good stories. And then I'm going to end with a point of personal privilege here as a thank you to all of the wonderful mothers who are out there. I'm going to single out 3 of them. My mom, Darlene, still down on the farm at our place in a small community in Nebraska. Just a wonderful mother, taught me what it meant to serve others, and I am grateful, Mom. Thank you. And to my mother-in-law, all the mother-in-law jokes don't work with me because I have an absolutely fantastic mother-in-law in Lynn Whipple who raised 4 wonderful, strong daughters, and I have the privilege to be married to one of those who is the most wonderful mother to Hope and Gus I could ever ask for, the First Lady Gwen. Thank you for that. So to all the mothers out there, happy Mother's Day, and we'll talk soon.
That was today's COVID-19 briefing by state leaders. We learned that our confirmed cases of COVID-19 has now topped 10,000. 26 more Minnesotans have died.